Welcome to the third session of VBP Educational Program. Today we will discuss the lifestyle modifications. These are the objectives of today's lecture. At the end of the lecture, you should be able to state the importance of lifestyle modifications in relation to treatment of non-communicable diseases and name the stages of trans-theoretical model and explain the effective communication related to non-communicable diseases. So before going into lifestyle modification, let's look at what lifestyle means. Lifestyle is the way a person lives or how they eat and drink, how they work, and their habits and leisure activities. So the lifestyle of each person is different from others. And lifestyle of humans has subjected to change throughout the evolution, and it will differ according to the region, ethnicity, and religion and other socioeconomic factors. Lifestyle modification involves altering long-term habits, for example, healthy eating or physical exercise, and maintaining the new habit or behavior for months or years. Lifestyle modification can be used to treat range of diseases including obesity, diabetes, stress, and risky behaviors such as smoking and excessive alcohol consumption. Let's look at why lifestyle modifications is so important. Because it kills 71 million of people each year, that is 71% of all deaths globally. And 15 million people die from NCDs between the ages of 30 and 69, which is the productive years of one's life. And over 85% of these premature deaths occur in low and middle income countries. And cardiovascular diseases account for most NCD deaths, around 17 million people annually, followed by cancers, respiratory diseases, and diabetes. These four groups of diseases accounts for over 80% of all premature NCD deaths. And tobacco use, physical inactivity, and the harmful use of alcohol and unhealthy diets all increase the risk of dying from NCDs. As I mentioned earlier, the incidence of NCDs increase in both developed and developing countries. Prevention for most NCDs include lifestyle modifications. So as clinicians, the knowledge of lifestyle modifications will be important in the management of patients with NCDs, which is responsible for morbidity and mortality in patients worldwide. Now let us move to the patient scenario 1. A 65-year-old patient comes to your clinic complaining of polyuria, polydipsia, and weight loss for past 4 weeks. He doesn't have history of any other diseases. So what is the possible diagnosis here? And what is the physical examination you would like to perform in this patient? And what are the investigations you would like to do? And how would you manage the patient? This is what is needed in the management of this patient. So this is a kind of a group work, so you can answer these questions by your own. We will try to find the answers for the questions when we move forward. So these are the other important things in the history of this patient. So the past medical history is not significant, and the past surgical history is also not significant. And in family history, his father had diabetes and he was diagnosed at the age of 50. So let's look at the examination findings of this patient. Height is 173 centimeters, weight is 105 kilograms, and BMI is 35. So this patient is an obese patient. And skin, he has acanthosis nigricans, and blood pressure is 130/80. And fundoscopic examination, no abnormalities. Foot examination, sensation normal, and no ulcers. So the investigations, HbA1c is 8.7, which is higher, and fasting blood sugar is 151. The OGTT results is 233, and TAG is 208, LDL 110, HDL is 34. Liver function and renal function is normal. So then we can come into the conclusion that this patient is a type 2 diabetic patient without complications. So type 2 diabetes uncomplicated. So this is the management given to this patient by 3 doctors. So let's go one by one. So the first doctor thinks the patient has type 2 diabetes. I will give hypoglycemic medications to control plasma glucose. Taking medications will be easy option rather than changing the lifestyle. I will advise him to take the medication properly. And the second doctor thinks the patient has type 2 diabetes. I will start oral hypoglycemic drugs, but I will just tell the patient to control diet and do exercises regularly, as the clinic is a bit busy today. These days, people know much about the importance of exercise and diet control. The third doctor thinks the patient has type 2 diabetes, and I will first ask the patient about his lifestyle. And I will discuss the lifestyle modifications that he can do, and I would educate him about the recommended diet and exercise. Then I will consider starting drugs if it cannot be controlled. So what do you think about these management plans? Actually, in diabetes, lifestyle modifications plays a major role. Some doctors might think it is just easy to give drugs rather than wasting time on advising patients. But we always need to listen to the patients and try to modify their lifestyle at their own pace. Because diabetes is always associated with what we eat and the lifestyle of people. This is the management of diabetes. So it has basically 4 goals. Lifestyle modification and patient education, maintenance of good glycemic control, multiple risk factor management, and prevention of complications. So what we are focusing is basically this part, and I have discussed these things in the last lecture, so you can go through them if you are not familiar with this. Now let's listen to the conversation between the doctor and the patient.
What about your family?
Doctor, I have 2 kids. My son is married, and my daughter is doing her undergraduate studies. I live with my daughter and my wife. My wife is a housewife. I think I have a successful family life.
Really nice to hear that. By the way, what about your diet?
Doctor, my wife usually cooks for us. I used to buy some snacks from the nearest cafe in the night if I feel hungry. Other than that, we usually don't eat outside.
How about your daily life?
Doctor, I work as a security officer, and my shift is from 6 p.m. to 6 a.m. I used to come home around 7 a.m. and have some food and sleep until 1 p.m. Then I will have something for lunch and watch TV and go back to work at 6 p.m.
What about exercise?
I don't do exercise as a habit, doctor. I think I am healthy, though I look a bit fat. You see, I had got this body type genetically from my family.
So this is kind of the food diary of this patient. Around 5:30 a.m. he has a cup of milk tea, which is full cream, and for breakfast, bread, around half a bread with dal curry, and lunch, 3 cups of rice, chicken 3 pieces, beans, curry, and at 3 p.m. bun and milk coffee. At 7 p.m. dinner, noodles 2 cups. 12 a.m. snack, burgers and french fries by the nearest cafe. And between 12 a.m. to 6 a.m., Coca-Cola and milk coffee to keep him awake. So what are the lifestyle modifications you should consider in this patient? In these patients, there are a lot of changes that you can do related to diet, especially regarding the amount of what he eats and the types of food he eats. So you can educate the patient regarding the healthy diet recommendations for diabetic patients using the plate method, and you can give some knowledge about foods to avoid, like starchy foods, deep fried foods, and to reduce intake of added sugars and etc. And I have included these details in the recorded lecture, so you can refer to that as well. This is the instructions given to the patient by the doctor. You must improve your diet and start exercising and lose weight and test your blood glucose and take your medications. So what do you think? Will the patient be able to follow your instructions? Actually, he will not. We have to look at much more deeper into this, because this is asking a person to change his lifestyle, which is not so easy and needs lot of efforts. Just giving details or advice to change the diet, doing exercises or to lose weight will not help. We need to think whether our patient is ready to accept that change. To understand that, we need to understand the stages of change which is given in the trans-theoretical model. This is the trans-theoretical model. It has 6 basic steps: pre-contemplation, contemplation, preparation, action, maintenance, and termination. What is important to note here is most of the patients will be in the first 3 stages of trans-theoretical model, that is pre-contemplation, contemplation, and preparation. In the earlier stages, it is really challenging to change the behavior of patients, and it is important to identify the stage of your patient in terms of lifestyle change. And the strategies that you need to use will depend on the stage of your patient. Now, let us look at the stages of trans-theoretical model in details. So, pre-contemplation is when the patient is not ready or not intending to take action in the next 6 months. The 3 Ds of pre-contemplation explains their thinking. So, that is don't know how, demoralized, and defensive. Don't know how means that they may not even realize the serious harm of their behavior, and they are not convinced that they even need to change. And people who are demoralized is like they want to change, but with the repeated failures, they are feeling demoralized and feeling uncertain about their abilities to change. And some people are defensive, so there is a tendency to defend one's risky behavior, especially if it has become an ingrained habit or addiction, like drug addiction. Then we will look at this patient scenario too. Mrs. Pieris is a 40-year-old newly diagnosed diabetic mellitus patient in her initial visit. She has 3 kids, who is 18 years, 15 years, and 10 years, and her husband is a government officer. She is doing a job in a company as a secretary, and she doesn't do any regular exercises, and she eats lots of starchy food and sweets. So how do you identify the stage of this patient regarding the lifestyle change, and what are the strategies that you can use to promote the lifestyle change in this patient? Then we will look at how to communicate effectively with this kind of patients by listening to the conversation between the doctor and the patient.
Mrs. Pierce, do you want to do some physical exercises or change your diet to control your diabetes?
No, doctor, I don't think I will have time to do exercises as I am busy. I think it will be much easier for me to take pills than doing physical exercises.
So, today I will give you some medication to control your blood sugar level. I would like to see you in 1 month to check your sugar levels. In the meantime, I suggest you think about what we discussed today. If you are ready to change your diet and want to do some exercises, we will discuss about it in the next appointment.
Okay, doctor.
According to the conversation, you can see that this patient is not ready to change her behavior. So she is in the pre-contemplation stage. Pre-contemplators are often characterized as resistant, unmotivated, or unready people for help. Here, you have to increase the awareness via information, education, and personal feedback about the healthy behavior and about the advantages of changing their behavior. And we should pay attention to their feelings like fear, anxiety, or worries about the unhealthy behavior, and feeling inspired and hopeful when hearing about how people are able to change to healthy behaviors. It is really challenging to change their perception regarding the lifestyle change. And we need to understand that they might need some time and some effort to change their behavior. Confrontation or frightening patients by highlighting the side effects of disease conditions is not the ideal way to change. So the next step is contemplation. In contemplation, patients are getting ready or intending to take action in the next 6 months. So people at this stage is more aware about the serious consequences of their risky behaviors, and they talk about their behaviors, read, search online, but won't actually take action towards making change because they are more excited and aware about the pros, but cons became more evident and cause confusion. And they will think, is the change really worth it? And when in doubt, they won't act. This is the conversation between a doctor and a patient who is in the contemplation stage. We will first pay attention to it.
Mr. Dias, do you want to do some physical exercises or change your diet to control your diabetes?
Well, doctor, I think that doing exercises is good for me, but it is difficult to find time as I am busy these days. I should think of managing my time well to do some exercises. But still I am not very sure whether I'll be able to do exercises.
So, Mr. Dias, now you can see there are a lot of benefits if you change your lifestyle other than management of diabetes.
Yes, doctor. I can understand.
So, in the next appointment, I would like to meet with your wife as we can discuss how to modify your diet.
Okay, doctor.
Like in this scenario, we need to help the patients to recognize his or her self-image with and without a particular unhealthy habit. And we have to resolve the ambivalence and discuss about the barriers. The third stage of trans-theoretical model is preparation. At this stage, the patients are ready to take action in the next 30 days, and they are excited about the possibility of getting free from the unhealthy behavior, but they are afraid of the big D of preparation, which is dread of falling again. This is the conversation between a doctor and a patient who is in the preparation stage. We will first listen to that scenario.
Mr. Alex, do you want to do some physical exercises or change your diet to control your diabetes?
Yes, doctor. I have to lose weight, and I am planning to walk for 1 hour every day.
Mr. Alex, really appreciate your interest on doing exercise. Let's try to develop a realistic goal for your weight-losing journey. And let us discuss more about the exercises that helps you to lose weight and dietary modifications that is possible.
That's good, doctor. I was wondering whether I will be able to continue doing exercises.
Likewise, we should encourage the patients in a way to increase their self-belief about ability to change. And we should help them to develop realistic goals and provide support for the patients, such as providing dietary recommendations and discussing about the possible exercises. So the fourth stage is action. So here, the patients have made the behavior change, but for less than 6 months. So in this stage, action might be completely stopping the behavior. For example, total abstinence from smoking or reduction the level of their behavior. So for example, not total abstinence, but reduce the number of cigarettes smoked per day. So this requires greater commitment, and in this stage, the relapse is common. And the huge D of this stage is too many demands, which can lead to regression rather than progressing during the action stage. These are the strategies that should be used in the patients in the action stage. We should monitor and review the progress of patients and give rewards and congratulate the patient on their success, which is called positive reinforcement. And if the patient has undergone failures, try to encourage them to learn from failures and provide them adequate support. And if they relapse, We should make sure that they will not return to where they started from. Instead, we should encourage them to recognize the progress they made and revise their achievements. And we should re-emphasize the benefits of the lifestyle change. The fifth stage of trans-theoretical model is maintenance. So at this stage, people are doing the new healthy behavior for more than 6 months. And this is how they feel about the lifestyle change that they have made. I may need a boost right now to help me maintain my weight I've already made. I need to prevent myself from having a relapse of my problem. And we need to be prepared to deal with the big D of this stage, which is distress to maintain the desired behavior change when helping patients in this stage. The strategies at this stage is we must maintain and review their plans and try to prevent relapse and try to involve them in motivating other patients with the similar condition. And we can ask them to do stimulus control, which is basically done by avoidance. For instance, avoid looking at advertisements of sugary food if they are maintaining their diets. The final stage of a trans-theoretical model is termination. So at this stage, the patients are confident with the change and not tempted to relapse. There are 3 main criteria to determine whether they are in this stage of termination. They have zero temptation to return to their previous problem behavior, and they have full confidence or self-efficacy that they will not relapse back to their old behaviors no matter how challenging the situations are. And they are so comfortable with the change that they no longer have to make any efforts to keep from relapsing. So this is the summary of stages of trans-theoretical model. In pre-contemptation stage, the patients are not ready or not intending to take action in the next 6 months. And in the contemptation stage, they are getting ready and intending to take action in the next 6 months. And in the preparation stage, they are ready, but ready to take action in the next 30 days. In the action stage, they have made the behavior change, but for less than 6 months. And the maintenance stage, they are doing the new healthy behavior for more than 6 months. And in the termination phase, they are confident with the change and not tempted to relapse. This is a summary of the trans-theoretical model. Thank you very much for joining today's lecture. Please complete the assessment 3 after you go through the lecture. Thank you.